So the focus of my PhD is using simulation methods, using data analytics to design clinical trials. Clinical trials actually have a really high failure rate. It can be upwards of about 90% of these drugs don't make it to market. So we're hoping that using these simulation methods, we'll be able to design clinical trials that can be delivered more effectively. So the CAST award allows me to collaborate with industry and give me some opportunities that I wouldn't have in a normal PhD. So we actually work with an industry partner called Exoristics, and they work on using these simulation methods to design clinical trials. And there's very little publications available on the subject. So Exoristics have given me some access to their software and some courses that they've developed on these methods, so I can use them myself. I suppose through the PhD, I've been given access to clinical data sets from clinical trials. And before, if I went straight into industry, I wouldn't have had the opportunity to learn to analyse these data sets before going into a job. And then also, as I said, there's very limited publications available in simulated clinical trials methods. So I feel like this would be quite a specialised skill set that I now have and I can use in a job in the future. I think working in industry is actually really helpful because especially with the very small amount of publications available in simulated clinical trial methods, I'm able to contact these people in Exoristics, the company I have contacts with, and they're able to point me in the right direction, and also being able to use their software that I wouldn't otherwise have access to because it's very expensive. So I think we hope that using these simulation methods we'll be able to design clinical trials that have a higher success rate, and through this then more drugs will be able to make it to market, especially in respiratory diseases that don't currently have any licensed treatments, and this will help to improve health-related quality of life for these patients. So I also feel like what I'm doing managed to fit in with iReach's aims, because by designing these clinical trials of a higher success rate, this will help the overall quality of life for patients.